punarutpadyanti. It is clearly explained about skin elevated circular patches. Here, how to differentiate the Dadru Kushta and other diseases. Here, I will tell one thing. See, here round type of patches in clearly explained in Samhitas. One is Dadru, second is Vicharchika, and third is Kitiba Kushta. In three diseases, patient come with circular patches only. Here in Dadru, in clearly explained Utsanna Mandala, that circular patches, these circular patches, these patches is consist with pustules like this, and central is very clear. But in Vicharchika cases, it is also circular, but the central space also consists with any papules or pustules, any watery discharge. But in Dadru cases, only circular, that papules only present, central is very clear. But in Kitiba Kushta, this is also circular patches only, it is very scaliness is present. Sometimes that is Snigdha Kitiba Kushta are present. In this also small pustules present also there. It is also very rare case, but here in Vizag and any other districts we will see only Roksha type of Kitiba Kushta. So you have to diagnose like this: central clear small pustules in Utsanna Mandala, that is clearly explained Utsanna Mandala, that circular elevated patches are present, and these are the symptoms: Kandu, Pedika, Raga, Srava, Atashi, Pushpavarna, Shota, and this is the main. Prasantaniyacha punarutpadyanti. This disease will subside and again reoccur. That's why we have to treat very carefully in these cases. Second is Pama Kushta. Here Pama Kushta, Sveta, Aruna, Srava, Pedika. There is a scattered boils or eruptions present, clearly explained that Spika, Pani and Pada and Purpara. Here it clearly explained buttocks, hands and forearm. These are the symptoms: Kandu, Toda, Daha, Pitika, Srava. Here this is also, see how to diagnose the Pama Kushta in patients. This Pama Kushta actually it's come with in fingers joints, or this is elbow joint or buttocks region, and this ankle joint. These joints are present, scattered, only pustules present. After the pustule it open and it comes as that burrow like structure. That is the explained as Pitika, and Srava ooze comes out from that lesion. This is the Pama Kushta. So in these both diseases it is a Sankramika. So one vehicle is important. That vehicle is the Krimi. Here Krimi also in Vimanasthana clearly explained Bahya Malaja Krimi. These Bahya Malaja Krimi transmitted from one person to another person. The disease develops from one person to another person. That is it called as Sankramika Roga. So this is the Samprapti of Dadru and Pama Kushta. That is the whatever that first slide I explained, Sankramika Roga, that is the Prasangat, Gatra Samsparshat, Nishwasat, Sahabhojana, Sahasayana. That is the sharing bed, class, etc. That is infected person, that contagious diseases, Sankramika, that transform to one person to another person because of this Malaja Bahya Krimi. That Krimi entered into Tvak through Sveda and vitiates Tvak, Rakta, Lasika and Pitta, Kapha Pradhana Tridosha. That Sankramika Bahya Malaja Tvak Vikara develops. That is the Pama and Dadru Kushta. Here treatment principle is very important. Whatever it explained in Charaka Sushruta, that you have to, Charaka Sutrasthana and Charaka Vimanasthana, you have to, that application is required in these type of cases for treatment. In these type of cases, we have to go for Nidana Parivarjana and Prakriti Vikata and Apakarshana. Here, Nidana Parivarjana is main line of treatment. Why? Because the disease transformed to one person to another person through that cloths and garlands like that. So, we have to avoid that causative factors is the major line of treatment in these Pama and Dadru cases. And second is Prakriti Vigata. What is Prakriti Vigata means? It is a internal and external medication, Antar and Bahir Parimarjana Chikitsa. And last is Apakarshana. It is the Shodhana Karma. Here, Prakriti Vigata Chikitsa, that is Antar Parimarjana and Bahir Parimarjana, that is Antar Parimarjana means whatever you give internal medication. These internal medication also, one schematic prescription will be there in these two cases. That is the first is Krimihara medication. Whatever it come Pama and Dudra cases to you, Pama and Dadru cases, that time first we have to start with Krimihara medication. It is very important to treat this type of cases to stop reoccurrence. In allopathy, you have to go, the patient, they will give one steroid and one antihistamine drug, it subsides, again it will develop. That time only that patient come to Ayurveda. In this time, you have to give proper medication in these cases to stop reoccurrence of the disease. That is the main is Krimihara medication, and along with Krimihara medication, you have to give Nitya Virechana medication and Rakta Shodhaka Dravyas, Kandugna Dravyas, and maintain the proper Roga Nirodhaka Bala. This is the primary line of treatment of Pama and Dadru, that is Sankramika Rogas. And second is Bahir Parimarjana, that is external treatments, Sarvanga Abhyanga, Ushna Jala Parisheka, and dusting powder, maintain proper hygienic. These are the Bahir Parimarjana Chikitsa. It is Apakarshana, Shodhana Chikitsa. In these two cases, Virechana is required after the Krimihara Chikitsa. Here, Virechana also Tiktaka Gruta with the special Vidanga Churna. You have to give Gruta with Vidanga Churna. At least 5 grams of Vidanga Churna you mix with Gruta. It is one of the special drug that Vidanga to stop the reoccurrence of the disease. And second is Sarvanga Abhyanga. After Snehapana, you have to give Sarvanga Abhyanga, especially with Estimadu Taila. Why Estimadu Taila here? It is a best Varana Ropana. So, you have to do Sarvanga Abhyanga with Estimadu Taila only. After that, Virechana, the Trivirut Leha and Triphala Kashaya. After that, Samsarjana Karma advice. Here, total topic is first Nidana Parivarjana. Second is Prakriti Vigata. In this Prakriti Vigata, first primary line of treatment is Krimihara Chikitsa with Nitya Virechana. Next is Apakarshana, that is Shodhana. After Apakarshana, you have to give Rasayana Chikitsa and Kapha Pitta Hara, Rakta Shodhaka Dravya, Kandugna Dravyas. This is the major line of treatment to stop reoccurrence of the Dadru and Pama Kushtas. First, you have the examine the lesions. So, that patient after the visiting of allopathy doctors, then will come to you. Then the lesions are very dry. Why? Because they are giving any antibiotics or steroids. The lesions are very dry. Don't confuse. Why? Because it is acute or chronic. You have to see, and this condition is Ruksha or Snigdha. Then observe the disease spreading nature. It is fast spreading or slow spreading. Then start with Krimihara Chikitsa. Then internally you have to give Krimikutararas or Krimimudghararas along with Vidanga Arista. If intense itching present, add Kadirarista also. Then Arogya Vardhini Vati, it is a Nitya Virechana Dravya along with one Agada Dravya, that is a Bilvadi Gulika or Doshi Vishari Gulika. This Bilvadi Gulika or Doshi Vishari Gulika, it stops reoccurrence of the disease. It's very useful in my clinical practice, that Bilvadi Gulika very useful to stop the reoccurrence of any this type of Sankramika Rogas. And then start, that is the after Shodhana Chikitsa, you have to start Kadirarista, Gandhaka Rasayana, any neem tablet, Nimbadi Kashaya or Patoladi Kashayam. It is the mixed powder for increase the immunity or maintain the immunity. Guduchi, Amlaki, Estimadu, that is a mixed powder. Equal quantity you have to mix it, then give 3 to 5 grams of powder morning and night. And external application, see here you have to concentrate, the lesions are dry, the lesions are wet. You have to observe the case, that is in snigdha condition, you have to give prakshalana. That is the kashaya prakshalana you have to give. In snigdha condition means the lesions are ooze or any watery discharge from the lesions, then only you have to give prakshalana, triphala or panchavalkala prakshalana, at least nimba with haridra, any powder you have to boil with water and prakshalana it. After that snana with any neem contained soap. After that dusting powder. It's very important. If any snigdha condition of the lesions, we have to dust the powder, then it will, the snigdha oozes will reduce. That is some pharmacies are prepared cutis powder, it is a Vasu Pharma. The derma charge powder, it is Emil and Dashapushpa Churnam. In Ruksha condition, the lesions are, it is very dry condition, then only you have to give oil application. If you give oil application in snigdha condition, the disease will aggravate. But don't give that. That's why you have to observe the skin lesions. Then only you prescribe the treatment. In Roksha condition of the lesions, you have to give oil applications. That Chakramarda is very beautiful drug to reduce the cases of Dadru Mandala. And Maricha Taila, it is very beautiful medication for reduce the Pama condition. And Aladi, Nalpamradi also you have to give, and Ushna Jala Parisheka, it is very important. If Snigdha condition or Roksha condition, you have to give Ushna Jala Parisheka, Snana with neem soap, and some ointments, lapas, it is trichoderm, funguin, Desura, AF. So, coming to conclusion, the incidence rate of Sankramika Bahya Malaja Kushta gradually increasing day to day because of improper vihara like uncleanliness of body, sharing clothes of others, etc. In these two cases, Dadru and Pama, depending upon Nidhana and Lakshana, it was diagnosed as Sankramika Bahya Malaja Kushta. Nidhana Parivarjana is the main method of keeping oneself free from the disease. Krimihara Chikitsa is the first line of treatment, this type of Sankramika Tvak Roga. After Krimi Chikitsa, you have to do Shodhana Karma according to the disease condition. After that, you have to give Rasayana, Kandugna and Rakta Shodhaka Dravyas. External treatments always depends on the conditions of the lesions. Thank you one and all. So if you have any doubts, you ask me about that Sankramika Rogas.
Any questions from participants? Welcome.
In your OPD, these two cases will come regularly. But after Ruksha condition only it will come. The patient already used the antibiotics, steroids, all used medication, that disease totally suppressed. It means already Charaka clearly explained Lena dosha. That dosha is present in Dhatugata level. If any Nidana factors the patient exposed to Nidana, that Lena dosha again develop the disease. So, because of antibiotics and steroids, the disease fully subsides with Dhatugata level only. It secretly situated in Dhatugata level. If any uncertain circumstances, uncertain causative factors, that disease again reoccur. So, you go with the Ayurveda treatment, that is the Krimihara Chikitsa, and next Shodhana Chikitsa, next Shamana Aushadhi and Rasayana Aushadhi, and that immunity development powder, then the disease will totally relapse. Okay, no reoccurrence in the skin disease. You treated like this only, no reoccurrence in Ayurveda. Otherwise, the disease will reoccur. Okay, be careful like treating the disease like reoccurrence like Sankramika Roga diseases. Thank you, one and all.
Thank you so much, Kamalakan sir. I wanted to stay here. I request Andrea Murthy sir to give his inputs. And have a discussion with Dr. Kamalagar.
I want to congratulate the organizers, especially Dr. Sundar Raj for bringing a wonderful speaker, Kamalagar. Should you be glad? The name Kamala itself indicates Krishna. So if we take the name of Kamalagar, all these Krishnas will vanish. That is my strong belief. Now, usually what is happening in Ayurveda is, everyone wants to do specifics of everything. In modern science, one person is called skin and mental disease, is specialist of it. Another person is a PhD specialist. Now you have to decide what you have to become. Correct? If you want to become skin specialist, follow that Kamalagar's path. Number one. Number two, I am not doing over recommendation of that Kamalagar, but he is giving just about how to tackle the Sankramika rogas from the skin. When you get these skin problems, you refer to Kamalagar. You take his phone number, refer to Kamalagar. How you have to refer the patients to Kamalagar. Your brother, sister, neighbors, people are having this problem. If you refer these cases, he will give you the treatment. And after the treatment, you are doing follow. Like that, what is happening? I do not need to. You tackle heart disease, you tackle lipoma, you tackle cancer, you tackle everything that is there in the universe. Ayurveda road will not take this. You should understand what are your limitations. Skin disease, refer to the specialist. If this type of referral happens, I would like to do it. It doesn't mean that we are giving more recognition to him or under recognition to yourself. A surgeon will handle surgery cases. Physician will handle physician cases. And when a surgery case comes, he refers to the surgeon. Even this certain eventually, Dr. Dharmatarayana Adhikar Adhiyalo, certain syllabuses, but it takes no limitations. So with these things I will tell you. You have given very wonderful points. There is no use of appreciation. The fellow already giving chats to me. Only that I am just putting additional points which I have gathered in last 50 years. I have been practicing since 50. Without boring you, I will use small hints. I am a postgraduate from Jamnagar. I did a postgraduate in 1978. One of my classmates did his research work on Chakram of the Bija. He is already described Chakram of the Bija. So, in the Chakram of the Paryaya Pada, synonym itself is mentioning Dadrohara. So, without any doubt, just to close your eyes in the Dadro conditions, especially in the groin region, severe itching is there, blackish discoloration is there, slight elevated things are there. You take this Chakram of the Bija powder, you take it from the market, because what is available in the market is shop you don't know. Fresh Chakramata. That is called as cassia tora. Latin name is cassia tora. Get this fresh Bija, they get powdered through this floor mill. Because you don't have body machine, no. What I do is the floor mill doesn't want to take this Chakramata. This is a poison food, I don't know. I will give you curing. 1 week, 1 kg wheat first. Then I will give you Chakramata Bija. Then I will give you 1 kg wheat. So all this thing has come in week, don't bother me. And that week, go to Pindi. First, I will give then Chakramata lens. This Chakramata Namaka wheat powder, you can patient can consume also. Now we have fresh Chakramata bean churna. Why am I getting bean churna? Means fresh bean churna always has that potency. You are studying bachelor, expiry date is there, take market sample, when it's prepared, you don't know what anybody will know, and you use it. Unfortunately, you use it when you play ID. So it's not effect. When you are having good quality, now look at the whole thing. Very simple medicine. So this Chakramata Bija Churna is taken and you give it to the patient. You ask him to mix it with lemon juice, fresh lemon juice, and apply over the groin area at one area, small area. No reactions will be there, but it is better. Ask him to come next day. He will tell 50%, 80% results. You are happy, he is also happy. So you apply it every day and he is good. Alternately, you can ask the person to use this Chakramata Bija Churna with Takra. Majjiga. Okay. Then very extraordinarily good results is there. This is one thing. Second thing, usually we are not supposed to tell the patient's names or patient's address. Now patient is also dead, patient's wife also is dead. There is no mistake if I am telling. One railway minister was there in the central government. His name is Gurupada Swami, central railway minister. His wife had a severe itching all over the body. Very itching, you can't imagine so much of itching. Allopathic doctors treated, all best allopathic doctors treated. The patient is not responding. Okay, the patient is brought to my OPD. My teacher had taught me one procedure. This has not been told in any textbooks. My teacher told these things. You know, Ajamuda powder is there. Okay, you have got steam bath equipment wherein you are using steam. I am using the steam bath equipment for a different purpose. It is called as Dhupana Chikitsa. DHUPANA, Dhupana Chikitsa. Dhupana Chikitsa has not been described by Kasturi. Dhupana Chikitsa has not been described in Panchakarma books. This I learned from my teacher and I am telling it to you. So what you do is you have got this heater, you put some iron gampa, iron basket, and you put Ajamuda bija churna over that. This dhupa is coming, smoke, not steam, smoke is coming. You ask the person to lie down over that area and apply some blanket or bed sheet. So what is happening? Full body is exposed to Ajamuda Dhupana. It is like magic. Magic means like you are putting a switch on and you are hitting fan, correct? Similarly, within some 10 minutes, he will tell all itching is gone. All itching is gone. Now just imagine, you are a teacher in the Panchakarma section, you are a teacher in the college, if your students is there, you show this. The student will tell you are God. Student will tell you are God. But allopathic doctors are not able to get it all right. In 10 minutes you are getting all right. They will think that you are God. So this type of miracles you should learn. And this type of miracles you should do it. But you should be careful of the danger also. Danger means what? This fire sometimes catches fire. Are you putting some firewood, coal, anything like that? No. It is not like ordinary steam bath. You are putting naked fire. In the naked fire, the patient bedsheet and other things also may catch fire. So be very, very cautious. That is the precaution, and good results are also there. Okay. During my undergraduation, I used to go to an allopathic doctor. I was having a lot of faith during the undergraduation. Allopathy is very good, very good. In the evening, what we do? We go to the allopathic doctor for a very busy practitioner and see what is it doing. He gives all injections, everything. I was also following him because I have not done my post-graduation. Imitate blindly, I am following what that person is doing. One patient came with some wound over the area. That patient lady had applied Nimbopatra Kalka. And after application, that swelling has increased. It is blackish color has come. All discharge is happening. My doctor gave at that time streptopenicillin. I am talking of 1960s. Streptopenicillin was the drug of choice. All these things are not. Diclofenac, yes. One company, Diclofenac means streptopenicillin. Streptopenicillin post was done. The patient went off. But I asked her, he was a teacher to me in the government and in the private IMA college, at the private college. Sir, you teach something, because we have heard one shloka. What is the shloka? Lepan nimbadalehi, vrana shodana ropanaha, bhakshana chardi kushtani, pirkasleshma kriminjayati. It is simple. Neem leaves are taken. Lepan nimbadalehi, vrana shodana ropanaha, bhakshana chardi kushtani, pirkasleshma kriminjayati. We give so much of praise for the Nimbapatra, and now this lady subject Nimbapatra. Why it is increasing? Is Ayurveda is wrong? But what happened? He is telling, see, we don't know what type of Nimbapatra she has taken. Where she has grinded. Some masala grinding, Rubugundu, that is masala Rubugundu, just Karnanta Patuli. So this is going to increase. Madi, with all good conditions, like you take water and pestle, prepare Nimbakalka, then you will get good results. Your hand should be good, then it will be good. If you do wrong instruments, you will get wrong results. This is what my teacher told. Okay, now, one Adhyaya in Charak Samhita has been started with the name Aragvada Adi Adhyaya. So, Chakapani is such a wise person. He tells why the name of this chapter is started with Aragvada. He is saying, one name is considered as Apamartha Kandali Adhyaya. Why Apamartha Kandali Adhyaya? Among seroviration drugs, apamarga tandula is the best. Look at the things. Just if you tell name of Rama, you will get punya. If you tell apamarga tandula name itself, you will get punya. Now, I am not blaming your college teachers. Whether they are using apamarga tandula as seroviration, no. We tell in the theory class, we ask in the YOC, apamarga tandula. What is apamarga tandula? Take Acaranthus aspera and remove the outer shell. Inside it is appearing like tandala only. It is rice grains. So it is called apamarga tandala. There are many seroviration drugs. Among those things, apamarga tandala is best. My question is, when if it is best, why don't you use the best? God only knows. GOK will tell you, God only knows. Okay. Apamarga tandala, my point is, if we start using apamarga tandala, we will get best results for these things. Okay. Forget apamarga tandala, we come to the Arabadadi Adhyaya. One chapter's name has been started with Arabada. Can you imagine? It is cassia fistula. Arabada is cassia fistula. Okay. You should just look at the Arabada tree when it is in flowering season. Beautiful, so nice to see. Among the synonyms of Arabada, if you look at the Arabada tree, if you look at the Arabada flowers, you will never forget in life. Swarnakaraha, Swarna Vrikshaha. As though golden flowers are there, some God has painted this whole universe with gold paint, gold color. It looks so nice. These flowers are so nice. You should observe this. Take a photograph at least and observe it. Swarnakaraha, Swarna Vriksha is there. Okay, we'll come back to this. Arabada Patra is best among Bahipalmarjana. Why Arabada has been mentioned in the first chapter's name starts with Arabadadi Adhyaya. Chekapani tells this is the best Bahipalmarjana. Yes, we should definitely use it. One of our PG students took up this research topic and he studied 4 types of Sweda are there. Among this Drava, Parisheka Sweda, 2 Swedas are belonging to Drava Sweda. So you do this Arabada Patra Siddha Jala Avagaha or Arabada Patra Siddha Jala Parisheka Snana. It will give wonderful results, extraordinary results. So take it, it is very easily available. Okay. In New Delhi, there is one institute specially for skin diseases. You can, when you go to Delhi, don't miss this institute. It is called BHEL, Bales Skin Institute, Bales Skin Institute, and they have brought a book, Common Diseases, Skin Diseases and Management. I am telling the authority. Why I am telling the authority? We should quote the authority. We should recognize the people who are there. Bale is not here. He will not put a case against me if I tell that. Very big institute, maybe some 300 bedded hospital for skin diseases is there in Delhi. Now Bale is not here, he is not watching me, but I should recognize that this has been mentioned in this book, Bale's Skin Institute, New Delhi. So here mentioning, a person is having severe itching. You go to his house, you have not carried any medicines, you don't have any bag. How we should get it all right? Very simple remedy. I tell, I go to the kitchen, take buttermilk. And I have got some, ask the household ladies to give cotton or fresh kerchief. I soak the kerchief in takra, put it over the patch. Within 2 minutes, itching will stop. Injection will not give quick results, but this will give quick results. Only thing is, don't leak this secret to other people. If you leak the secret, you will not get 500 rupees consultation fees. Correct? Everyone will start using it. Why we will put takra, sir? Why we should give 500 rupees to you? I wouldn't tell we should not tell the secret. Are you following me? For putting takra, you will give 500 rupees. This is my secret remedy. You use it. That is all. Okay. Now, Mulaka, you heard of Mulangi. Mulaka, Bala Mulaka, Sushka Bala Mulaka. Sushka Bala Mulaka means you take Bala Mulaka, keep it in the refrigerator. Sir, not refrigerator. This gentleman will come and quarrel with us now. Not in the refrigerator. Morning presenter, no, Shailendra will come and quarrel with us. So don't put in the refrigerator, keep it outside. So after 5 days, 7 days, that becomes dry. So look at the words he mentioned. Bala Mulaka, Sushka Mulaka. Bala Sushka Mulaka is a Tridoshahara. Bala Mulaka Sushka Mulaka is Tridoshahara. Pakku Mulaka is a Tridoshahara. Same Mulaka, Bala Mulaka is Tridoshahara. Pakku Mulaka is Tridoshahara. Now we want to do analysis of alkaloids, so many things. I Are you following me? The same dravya in different stages has got different properties. Okay, you are telling Shali is best padya. Shali, best padya. Which type of Shali? Rakta Shali is best padya. Shashtika Shali is best padya. Even in that, what is happening? Abdotpanaha Shalayaha means paddy grown 1 year back. In the ancient times, they used to purchase paddy, keep it for 1 year and use it. Maybe your grandfather used to it. He is mentioning very clearly Abdotpanaha Shalayaha. Now, in Guntakal or in Vijayawada, where I should get this Abdotpana Shali, that sharp fellow will tell Abdotpana, we don't know what is happening. But Chakradatta book, in his Parisista, he is mentioning, you are not getting Abdotpana Shali, what we should do? Take rice, fry it in the frying pan without adding any ghee or oil. So you will get the qualities of Abdotpana Shali. Are you following me? 1 year old Shali you should use. 1 year old Shali you are not getting. And you are not sure of what sample the shop fellow is giving. He will tell 1 year old sample, it may be new, it may be old, you don't know. But Chakradatta in his Parisista is mentioning, you take rice, fry it in the frying pan, but don't add any ghee or oil. It is called dry frying. And now this rice, fried rice, is equivalent to 1 year old rice. Okay. This is Chakradatta. I went to the Defense Food Research Laboratory people. There is one Mysore, very big laboratory, Defense Food Research Laboratory asked. I asked them, sir, what is the magic? Here the Acharya is telling, 1 year old Shali is not available. You are taking this rice and frying. He gave 1 hour lecture. What happens if you keep rice or paddy for 1 year? Same thing is happening if you fry this. He is giving all biochemical equation. Who is that? Expert in Defense Food Research Laboratory. Now tell me whether Chakradatta is great or Defense Food Research Laboratory is great. Chakradatta. Similarly, side by side, we did some research on Ajamamsa and Avimamsa. Ajamamsa is very good. I am not taking Mamsa, but a person comes who takes Mamsa. You advise him Ajamamsa. But in military, they supply Avimamsa, sheep. Instead of goat, they supply sheep. Avimamsa is Apartyatama, Ajamamsa is Patyatama. So they should know tons and tons of Mamsa is coming. How should we identify whether it is Ajamamsa or Avimamsa? They have found one index called as shearability index, SHEAR. Shearability means cuttability. Shearability index. The shearability of index of Ajamamsa is different. Shearability index of Avimamsa is different. So now Ayurveda is mentioning Ajamamsa, Avimamsa. For everything there is proof in science. But where the science ends, Ayurveda starts. Where modern medicine ends, Ayurveda starts. That being the case, we did not find justification for all the things. Okay. Now in the market, one oil has been researched from the Central Council for Research in Ayurveda and Siddha, CCIs. What they are using is there's a 777 oil, 777 oil. It is called a 777 oil. It is very useful in conditions of, the name they have mentioned, it is actually a Siddha system medicine. They have taken Wrightia tinctoria leaves, cutting it to small pieces and putting coconut oil and putting that full container outside in the sun. It is called as Surya Paki Taila or Aditya Paki Taila. No fire is there, and keeping it outside from the day morning to evening and keeping it back in the evening in the rain. Like that 15 days this oil is ready. That is called as Surya Paki Taila. You don't have to you don't have to put as a leaves, you don't have these things, means you can go for this 777 oil or Atrisar of the Atramed company. Atrisar is being sold in foreign countries now. In Germany, in Switzerland, if you go, this Atrisar is available. Atrisar belongs to the Atramed company. Okay. Now, we are talking of Krimi. Vidanga we should never forget. Vidanga Krimi Gnana. Vidanga Krimi Gnana means in food also, what I asked him is, you are taking this, what you call chapati. I asked the person to take Vidanga powder in wheat flour. When he prepared this chapati, he is telling Buddha Purva. Krimi medicine should be given with the Buddha. Okay, if probably it is possible, it will give it. Or else Vidanga Churna is taken. Okay, Vidanga Churna along with wheat flour, little quantity, and that can be used as chapati. Okay. Now, if all the other family members take it, they are also going to get good results. Once I am just sharing my experience. I will complete in 5 minutes. I was traveling from Mysore to Bangalore very frequently. One my neighbor is there in the railway compartment. I was asking, what are you doing? Sir, I am doing research on silkworms. Silkworms. What they do, you eat silkworms eat lot of fresh leaves. That silkworms get the worm infestation. Now, if you eat patra shaka, we will get creming in our body. Silkworms are eating patra shaka, so they are getting some creming inside. Worms are getting creming. I gave vidanga churna to that person. You give vidanga churna to silkworms. Are you following me? Then after 1 year he is saying, sir, your research is so good. Vidanga is acting good on silkworms. That is the report of the specialist who is working on silk. Following Vidanga Krimignanam is not only useful in human beings, in animals also it is useful. Okay. Now, when we are talking of Aragvada, my teacher taught me one thing. You know Gulkan? How it is prepared is Gulkan prepared with that flowers of gulab. So he told Aragvada Pushpa is there, with Aragvada Pushpa prepared Gulkan. Similar to Gulkan prepared from the flowers, you take Aragvada Pushpa. Aragvada Pushpa Gulkan is a Urdu Anurada. Very good, very tasty. Okay. Now, in conditions of Vicharchika, we have used Janukachal. Dramatic results. You cannot imagine. Where skin is color is dark, when Srava is there, skin color is thick. At that conditions, if you use Januka, next day patient will tell, you have done magic. You have done magic. Okay. So, Janukachal now we know, but we have done some next steps. You apply Januka for 15 days. Afterwards, over Januka Gurana, don't do anything. The rest of the places, you take rice flour and Haridra powder and put water, cook it nicely and prepare paste. And if you apply that powder and put bandage, next day you will find lot of discharge. That skin has become whitish color, thin color, everything is alright. So, Jaluka Charna, very good results. Okay. Then, my teacher taught me atochemotherapy. What is atochemotherapy? You take 5 ml of blood from the IV and give it to the gluteal area. 5 ml. So, gradually increasing. It is called as atochemotherapy. Atochemotherapy has not been told in the textbook, but one patient only taught me this technique, so that patient is after. So, I can speak for more number of times, maybe hours also on these particular things. From here and there, from my 50 years experience, I have taught all these things. But main, हम क्या बोलते हैं? మామిడికాయ ఊరగాయ ఉంటుంది. మామిడికాయ ఊరగాయ, చింతకాయ ఊరగాయ, నెల్లికాయ ఊరగాయ, భోజనమైలు. వాళ్ళు భోజనం ఇచ్చారు, మేము మీకు ఊరగాయ ఇచ్చాం. మేము ఊరగాయ ఇచ్చాం. So we should thank Kamalaka for a wonderful presentation. Thank you.
Thank you.
Both are good. Also the people, both of them are very delicious, sir. Thank you so much for sharing this wonderful feast of Ayurveda knowledge. Now, feast of organic food is also ready. So I request Anjay Murthy sir to offer the food. Okay, I request Kamalakar sir to offer food to Lord Dhanvantari while we chant Bhojana Mantra. Today is Vaishak Pahala Dwadasi, 4th June. The menu is rice made out of Ratna Chodi rice, and sweet kesari sweet is made out of Paharupi rice, and then there is this lemon rice made out of Orissa Basmati, not lemon rice, mango rice is there. Then we have dosa avokaya, pickle. It's not pickle, it's like it's a opposite. Then we have
number
dal made out of bottle gourd. Dal made out of bottle gourd and Kushmanda and Kushmanda magical sakra like Kushmanda
Takra.
Bodugumurke magical sakra.
Bodugumurke Kushmanda. Kushmanda with Takra.
Takra and make a dish out of it. And then Kambalika is sir. And the papad is out of moong dal. And then we have Chalamirka, soaked ones in the also as today's menu. And of course we have third method of motion.
Listening to this menu, we don't want to leave this place now. We want to stay here.
So, and all these items, including the rice, dal, vegetables, all these are organic.
ఇక్కడ క్లినిక్ ఎక్కడ పెట్టారు మీరు?
ఇంకే సార్ మరిపాలెం.
స్కిన్ డిసీజెస్ అన్ని హ్యాండిల్ చేస్తారా?
ఎవ్రీ
ఇక్కడ మీరు పీజీ అయింది ఇక్కడ పీజీ చేసేది ఇక్కడ మీరు క్వశ్చన్
ఎస్డిఎం హాసన్.
మంచి చాలా మంచి కాలేజ్. 50 ఏళ్ళు చేశారు. 50 ఏళ్ళు.
ఇయర్ 2016.
Offer the wishes to Lord Dhanvantari, and then we'll chant Bhojan Mantra and we'll have food.
సార్ మరి
ब्रह्मार्पणं ब्रह्मावि ब्रह्माग्नौ ब्रह्मणाहुतं ब्रह्मैव तेन गन्तव्यं ब्रह्मकर्मसमाधिना अहं वैश्वानरो भूत्वा प्राणिनां देहमाश्रितः प्राणापानसमायुक्तः पचाम्यन्नं चतुर्विधम् ॐ शान्ति शान्ति शान्तिः. Let us all chant Ahana Om Sahana Bhavatu
భవతు
Sahanau Bhunaktu
సహనౌ భృవత్తు
Sahaviryam Karavavahai
సహ వీర్యం కరవాయరే
Tejasvinavadhitamastu
తేజస్వినావసీహవస్తు
Mavidvishavahe
మా హిద్విషాహనే.
Om Shanti Shanti Shanti.
ఓం శాంతి శాంతి.
Thank you so much for your patient listening. We have not even given you a break. So take a break now and listen.
I should offer to God. So this would be useful.
Yes.
So because someone to get people of that, I will show some energy again.
Oh, okay. So one which has not been offered to us. Hey, ఇప్పుడు అక్కడ వండిన ఏదైనా ఏదైనా పొటాటో రెండు మూడు ఐటమ్స్ తీసుకున్నాం. సో శైలేంద్రజీ will show the difference between the food which is offered to God and which was not offered to God. Normally we offer to the God and we mix this food into the other food and we will give it to you, right? So now we will bring the food which is not offered to God. Anyone having Rudraksha Mala? Rudraksha. Please. You can come near to the stage.
Why we should offer food for God? How we actually offer food for God? How we have to practice your gratitude before you? So here, Annam Parbrahma Sloka. Right? Annam means only rice or means anything which will nourish us. Food. So wheat is also Anna, food is also Anna. Anna means food that will nourish us. Now, why it has to be offered? So when it is being given to us, we can get fruit or rice, whatever we are consuming. So when we offer to God, we are connecting that energy, the divine energy to it, which is becoming our raw material in which we can get nourished. So now you just see the energy of the food
definitely the energy will be good because it is prepared in the very consciously, mindfully, and very serene ways. But still, we'll see the difference of the energy of food. So remember this rotation, speed, and the rotation to width. Okay. Now we will see that. Okay, what can you see the difference? Speed fast. Fast and more wider. It's not just because the blade is wide. The energy, the spectrum, it's speed and wide. So now that food again. That is everywhere. Okay? So basically, we have to show the gratitude for all the beings which are being thankful for getting this food on this plate. Right from primitive like the Pashu Pakshi, right? Microbes, insects, birds, then trees, plants, everything. Apart from that, the person who is cultivating, getting the produce, cooking, and all it, right? Everyone. So we are showing gratitude. The Almighty who have facilitated all these beings as an instrumental for getting the food on first plate or to this plate, and then this food will become this ultimately. So even if there are some negative vibes on the way, it gets purified because we don't know. Like now we know the source of the food where it is being made, but many times we consume elsewhere. That's why there are many people who will never eat outside. They will cook their food by themselves. It's good. Because whatever food we are eating, those who is cooking, their people, thoughts, intentions, their things also get influenced. So that's why we have to purify. That is one purpose. Showing gratitude to all the beings, the Almighty, and that will become nourishment for us. Now we see the energy compared to before. The difference?
Excellent.
So we need something for our eyes when only it gets validated. But when we get that validation, we will not leave. It gets deeper and it will become a habit. That's why we need all these evidences. Mind is very logical, it needs validation, proof, reasoning, logic, but devotion needs nothing. Devotion is purest bhakti. You name any god. The devotion, like a devotee will not see all these things. You have that bhakti. So that's surrender.
The same food before offering, and he just showed gratitude and offered it with his own mind, and you can see the same, energy change, the same food. So this, I think, you'll keep it in your mind and offer the food to God before you eat. Whether you chant the Bhojan mantra or just express gratitude or whatever it is, that will change the energy of the food and that will change your entire consciousness, your well-being. Thank you so much, Shailendra ji, for practically demonstrating.
1 minute.
Yes.
Please come in. I just forgot to tell one particular thing. The other conditions, simple exercise is there. You don't have medicines, you don't have buttermilk, you don't have anything. Simple thing you do it. The itching sensation comes down in 2 minutes, 5 minutes, just like that. So the 2 minutes, when you see the itching in the groins area, that is shift. This is in this condition. This is very quoted in this Wales Skin Institute. According to Wales Skin Institute, they published one monograph. In fact, one Bhagavata, this has been told and I express my gratitude to that book. So, person having itching over the joints, the color has become blackish and it has become thick. Very severe itching is there. So, we are going to the patient's house, you don't have any medicines at that time. I am following the exercise told in the patient's skin issue. It was very simple but very effective. One. Like this. 20 times. In 20 times the digit disappears. No itching. No itching. You take 500 rupees and go.
So basically what's happening there is lymphatic drainage. That moment all the accumulated toxins in the lymph are getting released and blood circulation is flowing and then toxicity is gone.
This is a remedy, very effective remedy in a I'm not found any failure, but this is not a permanent remedy. This is only temporary remedy. But once you do this, the patient becomes your slave, not your slave.
Thank you so much, sir. So we have ocean of knowledge. So let us make results to collect the knowledge. Let us go, have good food, Amrutulya food, and come back as soon as possible. Doctors will be here. Session will start at 2, but we want more knowledge. We bring a big vessel and collect the knowledge. Please come as soon as possible.
Even the taste of the food, like normally in my classes I make them taste the food which is not being offered and which is offered. You will not have difference in the taste. Of course, it's very subtle taste. It's not a gross taste, it's a subtle taste.
So when you go to temple and take the prasadam, that is different. And what you prepare is completely different. Once you go, temple prasadam is different from our own food. Thank you.
Thank you so much.